Hello, this is Dr. Thomas at Integrity Dental, and today we want to answer some questions that you've asked about cosmetic dentistry and what that entails.
What is cosmetic dentistry?
What is cosmetic dentistry? That's a broad category that simply is talking about any form of dentistry that makes your smile look better.
How would I know if cosmetic dentistry is right for me or my family?
How would I know if cosmetic dentistry is right for me or my family? The answer for that is it's always right. The bigger issue is, is it the right time? I would say. There are a lot of good studies out there that show that a healthy, nice looking smile plays a huge role in anybody's ability for a high quality of life, getting jobs, making friends, having good relationships and things like that. If you're confident enough to smile, people tend to smile back at you. If you're not and you're self-conscious about your smile, it greatly affects your overall self-confidence and your quality of life, which in your appearance of enjoying your life and things like that. So having a good, healthy looking, not just healthy, but healthy looking smile, I would say is super important. More than what people just think of as often we think of it, oh, it's nice. It's nice to have your teeth look perfectly straight and nicely rounded and lined up and things of that nature. But I would say it goes a little bit further than that, especially for a lot of people, in that it helps you in your overall life and overall well-being to have a nice looking smile as well.
What's the difference between cosmetic dentistry and general dentistry?
What's the difference between cosmetic dentistry and general dentistry? There are certain dentists. We actually don't technically have a cosmetic dentistry specialty. Anybody who claims to be a cosmetic dentist is not a specialist in that category. They may have done a lot of extra study there, but you don't get a special degree in cosmetic dentistry. It's just somebody who has found cosmetic dentistry to be an area that they really enjoy and spend a lot of time doing and have developed some skills there, because there's a lot of skill that goes into making dental work look good, look natural, look like it belongs there as opposed to obviously fake. And so a cosmetic dentist is one that is just skilled and does more of the kind of work that makes dental work look like it belongs, like it was always there in a patient's mouth. When I do cosmetic work, which I do a lot of, it is something that has always fascinated me, and it's near and dear to my heart because I like healthy looking smiles, nice looking smiles. When I do that kind of work, my goal is always for people to look at you and just say, boy, you had something done, you look really good, but what is it? I don't want people to be able to say and look at you and say, boy, you had your front teeth done, huh? Unless they were really, really bad, I want people to look at you and say, boy, you did just, everything looks natural. It looks better than what it did before, but it should blend. It should look like you. It shouldn't stand out as obviously fake.
What is the difference between cosmetic dentistry and restorative dentistry?
What's the difference between cosmetic dentistry and restorative dentistry? There's not a big difference there. I would say cosmetic dentistry is still restorative dentistry in most situations. It's just done perhaps to a higher degree of precision or a higher degree of looking nice. Not all dentistry has to be cosmetic. Stuff that's further in the back, some people still place metal fillings or metal crowns that don't look like real teeth. I can tell you at Integrity Dental here, we don't have any metal in our practice other than titanium implants. So the crowns you get are ceramic. The fillings that we do are white. Everything is done with the intention of trying to make it look like it belongs, and it's not obviously there. That would be the goal. So a lot of restorative dentistry is still cosmetic dentistry. A simple filling in the back can still be a cosmetic dental procedure if it's done with a white filling and it matches nicely and it's hard to tell that it's there.
How can a cosmetic dentist fix my teeth?
How can a cosmetic dentist fix my teeth? They can fix your teeth the same way a general dentist does. Again, the dentist is a general dentist who has just chosen to do more cosmetic work and tailor their practice in that direction. What they can do for you, though, is make your smile look better in a lot of different ways. There's a lot of different ways to make your smile look better. If it's crooked and twisted teeth, doing Invisalign or braces is considered cosmetic work. General dentists can do that. Orthodontists can do that too, but doing dentures can be cosmetic work, taking out bad, broken down, decayed teeth and replacing with a nice set of dentures looks way better on certain people than their own teeth. You can also do implants and do permanent dentures that don't even come out of your mouth that look way better than really twisted or broken or decayed, stained teeth. And then just even regular fillings and crowns, whether they're in the front or on the side, but when they're visible, when you smile, if you do that and it looks nice and it looks natural, that's cosmetic dentistry, but it's still general dental work.
Can cosmetic dentistry improve my smile?
Can cosmetic dentistry improve my smile? Absolutely. Whether it's doing veneers or aesthetic looking crowns, which is just a veneer that goes all the way around the tooth essentially, or aligners that line your teeth up, or extracting all your teeth and giving you a nice new set of dentures. All of that should improve your smile.
Can cosmetic dentistry fix an overbite?
Can cosmetic dentistry fix an overbite? And an overbite, just so that we're all talking about the same thing, is when your bottom teeth are sucked way back in your skull and your top teeth come way out over the top of your bottom teeth. Buck teeth are an example usually of an overbite. And yes, that can be fixed in a lot of different ways. You can fix buck teeth or an overbite sometimes with simply doing crowns or veneers. You can fix that with doing braces and orthodontics and moving teeth around. Sometimes it requires a surgery where you actually move a jaw. And that usually isn't handled by a general dentist. Usually you're involving an oral surgeon if the jaw needs to be moved by actually breaking and repositioning the jaw. But that's a pretty involved procedure, and that doesn't happen a lot.
Can a cosmetic dentist fix crooked teeth?
Can a cosmetic dentist fix crooked teeth? Absolutely. That's what a cosmetic dentist does most of the time, is fix broken, crooked teeth, stained teeth. You can fix crooked, twisted teeth by doing braces. That's the easy one to think about. Some form of orthodontics, whether it's braces or Invisalign, clear aligners. Or sometimes you can simply do crowns. And the crowns, when they're put on the teeth, can be a way of masking or disguising crooked and malpositioned teeth, and really make a huge difference just by doing crowns and veneers, and not have to go all the way through a long drawn out braces or orthodontic procedure that takes months to years to complete.
How old should a child be before considering cosmetic dentistry, and can a cosmetic dentist work with young children?
How old should a child be before considering cosmetic dentistry? Well, you wouldn't want to usually do cosmetic dentistry on primary teeth or baby teeth. Some people want that, but usually in baby teeth, it's more about functionality and getting in, getting out, and making sure that the patient and the young child does not have bad memories of the dental office. That doesn't usually lend itself very well to slow, meticulous matching of colors and making things look nice. Cosmetic dentistry usually takes a little bit more time than just a dentist who goes in for functionality and does perhaps a quicker job, and it doesn't look quite as nice. So in kids, we rarely do that until we're dealing with the permanent dentition, and you're not going to have your permanent teeth in, all of them, until usually around age 10 to 12. Varies between patient to patient, and girls usually have their full set of teeth a little bit before boys do. But I definitely don't want to consider that any before that point. But we do braces. I mean, that's usually the first cosmetic dental procedure that we do for anybody would be some form of orthodontics where you move teeth around, and usually that starts in the full adult dentition. There are some exceptions to that, and often around age 12. Can you do crowns on kids? Yes, you can do crowns and veneers on children. But usually, again, you want to wait for that full adult dentition where teeth aren't going to continue to move, and the patient is going to be tolerant of a little bit longer procedure. And when we're 10, 11, 12, we're just starting to get to the point where we can hold still long enough to usually tolerate that sort of thing.
Can a cosmetic dentist work with young children?
Can a cosmetic dentist work with young children? Yes, but they usually prefer not to. Now, I might be a little bit of an exception to that rule because like I said, a cosmetic dentist is still a general dentist, but I do treat children. Now, will I do a whole bunch of veneers on baby teeth that are broken? No, I'm not going to do that. I would never recommend it. It would be borderline malpractice to do that, in my opinion, just because it's not worth the investment, and you run the risk of kind of ruining the patient because they're probably not going to like it when they're kids to have that much dental work done. Not going to be that compliant, and it can build bad memories, and we take that pretty seriously.
Is there any point where someone is too old or not well enough for cosmetic dentistry?
Is there ever a point where people are too old or not well enough for cosmetic dentistry? The answer to that is yeah, there probably is. If you are on a deathbed, or you are in the middle of cancer treatment or something like that, you have bigger priorities than a beautiful looking smile. And if your immune system is being taxed heavily by some form of medical treatment, may not be the best time to consider putting implants into your bone and expecting those to heal the right way so that you can do permanent dentures. So there's always considerations that go into whether or not a cosmetic procedure is right for a patient. And that's where having a good relationship with your dentist, one that you trust, is important.
What other conditions can be fixed with cosmetic dentistry?
What conditions can be fixed by cosmetic dentistry? That's kind of a broad question, hard to answer. It's more like what problem can't be fixed by a cosmetic dentist. Unfortunately, not all dentists really like the cosmetic side of things. Some people are just after functionality. They don't have an eye for it. There is an eye to being able to do that and do it well. And some people aren't blessed with that sort of ability, but they can still be good dentists in the realm of doing surgeries or other other kinds of procedures like prosthetics would still often be considered cosmetics. So I personally feel like cosmetics should be involved with most dental procedures, but you can fix a multitude of issues with cosmetic dentistry. It's usually a matter of, how much do you want to pay? Do you want to pay for just an average job, or do you want to pay for an above average job? And that's more what I hear when I hear cosmetic dentistry versus regular dentistry. Cosmetic dentistry is probably just paying a little bit extra for somebody who's willing to take the time to make things look very nice, work very well, and be stable so that you don't break it over time as well. So you're probably just paying for a little bit of a premium dentistry as opposed to regular dentistry, if you can understand, if that makes sense to you as far as a way to delineate between the two.
How can cosmetic dentistry change the structure of my mouth?
How can cosmetic dentistry change the structure of my mouth? Let's give an example like a full mouth rehab, which would be where you do crowns on almost all of the patient's teeth. We deal a lot with clinching and grinding these days, and if a patient has worn their teeth down to very smooth nubs, we'll say, a lot of times what can be done is crowns throughout the whole mouth to rebuild the teeth. The substructure is still healthy, they don't have cavities, but they have worn their teeth down a significant amount to where they can have pain. You can eventually wear it down enough to where you need root canals because you wear into the nerve and things of that nature. So if you put a crown on every one of the teeth in the mouth and you make it look like a nice natural smile instead of a really super flat, short-toothed smile, that's an example of how cosmetic dentistry also restores people's mouths and fixes that. And we also do that with regular crowns. If you break a tooth, a single tooth in the back, you can fix that with a metal crown that would be less expensive, or you can fix that with a porcelain crown that looks like a real tooth. And I would say it works just as well anymore as a metal crown, if not better, and it looks way better.
When is cosmetic dentistry considered oral surgery?
When is cosmetic dentistry considered oral surgery? That would be when you are doing something that would involve, surgery, which would mean removing teeth, possibly putting implants in. And you can do that in a couple of different ways. Even just a traditional dentures appointment or dentures procedure probably involves surgery, taking out the last of the bad teeth and making dentures to fill in where the patient no longer has teeth. Also can involve putting clips in or implants in so it holds the denture in place. And it can go even to the top level, which is where you put enough implants into where you can actually cement or screw those dentures in and keep them in the patient's mouth all the time, and they don't take them out at night. They don't have the option to take them out.
What are the advantages and benefits of cosmetic dentistry?
The advantages and benefits of cosmetic dentistry are that you have a confident smile, that you're happy with the way that your smile looks. When you smile around other people, they smile back at you. You go to a job interview, you smile, you look confident, you tend to do a lot better. So that's where I would say cosmetic dentistry makes a big difference in people's overall well-being and quality of life.
What is the process I can expect to go through if I get cosmetic dentistry?
Well, again, the cosmetic dentistry category is extremely broad. It almost covers all of dentistry, in my opinion. So, what to expect if you have a cosmetic dentistry appointment? Probably the main difference is a good long consultation to really determine what it is you're looking for and what you want out of cosmetic dentistry, because there's a wide range of preferences or what people like. Some people like their teeth to look like this, relatively flat, or some people like their teeth to look rounded. There's preferences in the way that teeth look. So a good long consultation with your doctor ahead of time to talk about what you want and how you want things to turn out is probably the biggest difference between cosmetic dentistry and regular general dentistry, where you decide all that ahead of time. You have that decided on ahead of time, and you take a little extra time in the planning phase.
What should I consider when choosing a dentist for cosmetic dentistry?
What should you consider when choosing a dentist for cosmetic dentistry? I would say is experience and an eye for it. Being able to see what the dentist has done already is very helpful. So if you can, a lot of dentists keep photos and keep track of their cosmetic procedures. So if you can see some of the things the dentist has done in the past, I would personally think that would help a lot. That's what I would want if I were in that situation. See what the dentist thinks looks good. And if you look at their before and after photos of procedures that they've done and you're like, that doesn't look that great, well, that would be a pretty good reason to maybe look elsewhere. But if you like what the dentist's preferences are and their before and after pictures, that's a good way to gauge whether or not you're a good fit.
Is cosmetic dentistry painful?
Is cosmetic dentistry painful? Again, cosmetic dentistry I think is about the same as general dentistry with a couple of small changes. So it has the potential to be just as painful or pain-free as regular dentistry does. So again, there I would say picking your dental office, picking your dentist and your dental provider is the biggest factor in determining whether or not cosmetic dentistry is painful. It shouldn't be any more painful than regular dentistry. Yeah.
What anesthesia options will be available during a cosmetic dental procedure?
What anesthesia options are available during a cosmetic procedure? Any anesthesia options that would be available for regular dentistry are available for cosmetic dentistry.
How long will it take for me to recover from a cosmetic dental procedure?
Again, how long will it take to recover depends on what procedure you have had. If you're doing a full mouth removal of teeth and implant placement and permanent dentures, that's going to be your longest recovery time. If it's a simple single tooth removal and putting a single implant in, the recovery time is very minimal. And or even just a regular crown on a single broken tooth, even less than that. So there's a wide variety there. Again, some skill of the operator will determine how much time you need to recover, and that's a good question to ask your dentist ahead of time, and they can give you a good idea.
Will I need to follow any specific directions after cosmetic dentistry?
Yeah, that's the answer there. Will I need to follow any specific directions after a cosmetic procedure? Yes, you will. There are a lot of things that will affect whether or not your cosmetic dentistry is successful, not just in the short term, but also in the long term. So make sure you have a good conversation with your dentist, both before and after a cosmetic procedure.
Is cosmetic dentistry covered by insurance?
Is cosmetic dentistry covered by insurance? Depends on which cosmetic procedure. Again, if it's something for functionality, but you're also doing cosmetic work, or a good quality crown often is needed for regular dental work. But if you have an aesthetic dentist doing it, yeah, they're going to cover that crown. If you're doing a whole bunch of veneers, and there's not a whole lot wrong with the tooth other than the fact you don't like the way it looks, sometimes insurance doesn't want to cover that. So again, a good question to ask your dentist before you start the procedure.
If my insurance won't cover the cost of cosmetic dentistry, are there financing options available?
So if your insurance does not cover your cost of cosmetic dentistry, is there financing available? Absolutely. We have several financing options available, and that's all discussed ahead of time at Integrity Dental. We want you to know the worst case scenario ahead of time, and then hopefully if there's any surprises, you get good surprises along the way, like maybe insurance covers more, or it didn't turn out to be quite as involved, and so the procedure fee is a little bit less. But yes, we have financing options available for all cosmetic procedures.
How can I schedule an appointment to discuss cosmetic dentistry?
Cosmetic dentistry at Integrity Dental is something that we really enjoy doing. I love making people smile more. Matter of fact, one of our website URLs is letUsHelpYouSmile.com. We would love to help you with your smile. We would love to make your smile more radiant, and something that you're happy with and confident with. So if that is something that you're looking to do, please let us help you with that. Our phone number is 719-545-2468. We'll do a free consultation. Please call us, schedule an appointment, and let's start talking about what we can do to improve your smile.